So let's say a patient comes and then, does this self-breast exam within the 7 days of the menstrual period and observes a lump. When she comes to you, how will you evaluate further?
So it depends on the age of the patient. If she is less than 30 years of age, we'll start with ultrasound. If she is more than 40 years of age, we'll start with mammograms. If it is between 30 and 40, we'll decide based on how suspicious the lump is. So we'll start either with ultrasound or mammogram. And the very good thing is most of the lumps turn out to be benign. 80 to 90% they'll turn out to be benign.
Can you emphasize that one more time? It's very important.
So even if you feel a lump, you need not get panicked. You should get it checked. 80 to 90% of the time, they'll turn out to be benign. Even if it is a cancer, it makes all the difference when you get it checked earlier. So it is important to get all the lumps checked, irrespective of your age, irrespective of your family history of breast cancer.
Ultrasound is a small machine that they apply gel on the area and then you scan it, similar to an ultrasound that they do for pregnancy. And you look for some morphological changes that may be consistent with a precancerous condition. Mammogram is an X-ray of the breast. And what will that X-ray show?
The X-ray will show the normal glandular tissue. The glandular tissue will be different for each patient. Some will have entirely fatty tissue with very less glands. Some will have more of glands. So it depends on how much is the glandular tissue. The visibility of a breast cancer can also be different. So that is where we have 2D and 3D mammograms. 2D is just one picture of the breast where you have to see, you compress the breast. Compress means there will be
an X-ray machine.
Like an X-ray machine, but there will be a plastic plate with which we'll compress the breast and the image is taken. Single image is taken. In 3D mammogram, we have slices of many images in slices. Layer by layer, we can see the breast so that even the smallest changes can be picked up using 3D mammogram.
Oh, that's also an X-ray technique.
Yeah. The same technique, but the imaging technique is different so that we can see layer by layer.
Wow. Okay. And then, so based on that, if there is suspicion, they get a biopsy.
Yeah.
They get a biopsy.
It's not like only cancers we'll do biopsy, and many lumps we can dismiss them as benign with imaging alone. Certain group of lesions, to confirm that they are benign, like they'll have slight suspicious features, but they can turn out to be benign. Even for those lesions, we would advise biopsy. It's not that if you are doing biopsy, it will turn out to be cancer.
So patients should not be anxious if the doctor is suggesting biopsy.
Yeah.
Even few biopsies turns out to be a benign condition.
Because the aim is not to miss a cancer. So we end up doing benign biopsies, but that is for the good. We should not miss the cancer at the early stage.
Correct. You're erring on the negative side of this. Okay.